This is the Health Matters program produced by the Ministry of Health. I'm Alicia Martin, and joining me on the program today is Dr. Heather Morris, the Director of the National Leprosy Elimination Program. Today we'll be talking about leprosy awareness, elimination, and prevention. Welcome to the program, Dr. Morris.
Thank you very much for your invitation.
So we observed the World Leprosy Day on January 29th, which was last Sunday, and we observed this under the theme Beat Leprosy. Could you tell us a little bit about the leprosy program and what you guys do down there?
Yes, certainly. So the leprosy program has been functioning as a central-based program of the Ministry of Health for many years. So I'm basically one of the directors. Everyone may know Dr. Holly Alexander, who has been a very well-known leprologist. And so after she retired, I took over. So the Leprosy Elimination Program, as it is now called, is located in the Palms Compound. It is actually a program where the dermatology or skin clinic is attached, because we recognize cases from seeing lots of skin patients. So it's a sister program of the Neglected Tropical Disease Program. And we all know that a neglected disease is so named because sometimes it is not given a lot of funding, and it is, not popular, because some persons believe that these diseases are not existing. But leprosy is still being transmitted in Guyana, and so the Ministry of Health has been supporting programs for neglected tropical diseases, of which leprosy has a formal program for.
Thank you, Dr. Heather. What is the situation here in Guyana with regards to leprosy? Is it something that we see across all regions?
No, so our leprosy burden is low. So how leprosy is, let's say, categorized in many countries are countries of low burden and countries of high burden. And Guyana reports annually less than 50 new cases yearly. And however, the incidence is not uniform through all of the regions, but we have, for example, certain regions, for example, Region 4, where there are endemic spots, not the whole of a region, certain hotspots, certain villages where we may find cases coming from. So our hotspot regions are regions 2, 3, 4, 7, and 10. And so it is not a problem. What is actually the problem is that there is a lack of awareness still. And so most of our cases, they actually come in advanced stages. So even though we have a low incidence, or we don't report, say for example Brazil, that reports over 10,000 cases annually, we still have to work on developing expertise so that healthcare workers can recognize this disease early.
Definitely. What strategies has Guyana developed to combat leprosy across those regions you would have mentioned?
Yeah, so there are many strategies, but the main thing is that we need to develop these strategies in an integrated setting. So even though we are a program and we work from a central unit, which is in the Palms Compound, we really need to integrate leprosy services in primary healthcare setting, meaning that medical doctors and other healthcare workers need to know about leprosy, know at least how to diagnose, and they should be able to treat the patient in their own communities. So one of the strategies is building capacity. Another one is making sure that prompt treatment is available. So as soon as there is a case, we treat that patient, and then we observe contact examinations, because it's important that we examine the contacts of new cases.
Yes.
Another strategy is trying to involve patients who would have been treated for leprosy as agents where they would be able to help the leprosy program, be able to break that stigma and be able to come out and speak to other patients. So basically, why I'm saying this is because when you have a patient with leprosy, they're very scared to divulge their diagnosis. So if we have a formal association of persons with leprosy, this helps to break the stigma, and that means that we can have early persons coming early, and then these patients can help other patients to complete their treatment. And so we have many strategies in schools for our school children because leprosy tends to affect those with low immunity. So we have our pregnant women, we have our elderly, and we have our children. And so strategies in school would involve using a mascot. So we have a mascot for leprosy because we find that attitudes in children are easier to change as opposed to adults. So we go into schools and we sensitize children early, all right, about what is it, how is leprosy transmitted, and the fact that you should not scorn a child in your classroom who may be treated for leprosy. Other strategies are rolling out of our preventive treatment for leprosy, which is a treatment which involves a single dose rifampicin for the contacts of new cases. So once the index case or the source case, the case who is being treated, allows us to divulge their diagnosis to family members and even neighborhoods, neighbors and work members. And once these contacts consent, we will be able to give this preventive treatment to contacts of leprosy patients, which I will mention again, not only household, but also neighbor contacts and social contacts. So this is helpful because once you would have been exposed, it actually helps to protect you in the future and also your children.
Wonderful. Thank you so much, Dr. Heather. We are going to go into a break and be right back with more on leprosy awareness.
No. Yup. No. Yup. No. Yup.
Welcome back to the program. For persons who've just joined us, today we're talking about leprosy awareness. And this year we observed World Leprosy Day under the theme Beat Leprosy. Dr. Heather, could you tell us a little bit about what leprosy is, especially for persons who are not so familiar with it? Share a little bit on that.
Yes, leprosy is a disease that when people hear about it, they always act shocked.
Yeah.
But it is a chronic infectious disease. It is a neglected disease. But guess what? It's a disease that can be treated in an outpatient setting. That person that is diagnosed with leprosy does not have to be isolated, does not have to be discriminated against. So what is the cause? Leprosy is caused by a germ. So it's not, I may emphasize, it's not a curse from God. It is not a sexually transmitted infection. It is not a genetic disease, meaning that it's not passed in your genes. So even though you would have been treated for leprosy, you will not pass it on to your children. And so this germ is called Mycobacterium leprae. It is a cousin of the Mycobacterium tuberculosis germ. But unlike tuberculosis, leprosy does not kill you. But the thing is with leprosy, if it is not recognized early at that skin stage, it will cause a lot of deformities. Now, how is it transmitted? Leprosy is transmitted when an untreated case is speaking or coughing or sneezing, so via air droplets. So if you are in contact with a person who, especially in your home, close-knit environments, in the community, at the neighborhood shop, in a dorm, in a workplace, you are at risk of inhaling this Mycobacterium leprae. And leprosy is also known as Hansen's disease, named after a Norwegian physician whose name was Dr. Amor Hansen, who discovered that this dreaded disease was not actually a curse. It was actually caused by a germ that has special properties. It's a very strange bacterial disease because it has a skin presentation and a nerve presentation. The skin presentation is considered the early stage, and at that stage, once the treatment is started, cure is possible. Cure is 100%. So what does this spot look like? It can be anywhere on your body. It is a spot that can resemble latter. It can look like ringworm. Sometimes it's circular. Now, if that spot is on a hair-bearing area, it may lack hair. The hair growth may not be as numerous as, say, on other areas. And that spot, characteristically in adults, would be numb, or they may not be feeling so well on that spot. This spot is not present for weeks to days. It's been present for months to years. And it's a spot that no matter what you put on it, Forderm, clotrimazole, Whitfield ointment, it will still remain there. And it gradually, slowly, over years expand in size, or you develop other spots on other areas of the body. So at that stage now, it's easy to recognize. Doctors, they ask certain questions. Actually, that spot is also non-itchy. It doesn't itch at all. And so at that stage, it's imperative that, persons come, because after months to years, the germ now advances to the nerves. And you remember, the nerves helps us to be able to interact with our environment, helps us to move our hands and feet. So if the nerves are damaged, that the damage is permanent, even though you take the treatment. The germ may be killed, but you will have these stigmatizing features, which is, clawed hands, clawed feet, inability to walk properly, and the stigma attached to it, which is, your employers looking at you, because they don't understand, and you are being socially excluded from lots of things.
Thank you for explaining what leprosy is, also some of the symptoms associated with it. We talked about prevention a bit earlier, and one of the things that you said is that it's curable. And I think we should emphasize that it is curable. It's something that can be cured. Could you tell us, how can we prevent leprosy for persons who are wondering, okay, I may know of somebody that would have experienced this before, but how can this be prevented?
So leprosy, like basic, looking after yourself can prevent you from acquiring this disease, because the incubation period of leprosy, meaning the time that a person inhales the germ to the development of the signs and symptoms, takes many years. But the thing about leprosy is that if you would have inhaled unknowing, the germ from an untreated case, the disease tends to start based on your immunity. So if your immunity is, say, good, you may not develop full-blown leprosy. So basic, taking care of yourself, eating healthy foods, we don't have to give the whole population treatment to prevent them from getting leprosy. Just being aware of it, and having a balanced diet. And shortly, when we roll out our preventative treatment campaign, we're hoping that we would be able to give specific consenting contacts the tablet, which is one dose, one lifetime dose. You don't have to take it another year or so. The single dose rifampicin, if they would have been in contact with an untreated case for many months.
Thank you, Dr. Heather. Could persons be screened for leprosy? Is it something that they can be screened for, where they visit their health center, find out more about it, and get screened? Is that possible?
Yes, that is why the leprosy program is part of a dermatology program, meaning that we screen lots of people. So they come in with a skin disease and we screen them. The first thing that is uppermost in our minds is this spot leprosy? And so looking at them and treating them, we are able to, for example, review them. We try not to tell them, for example, in the first consultation, this looks like leprosy, because we know that once you say that word, people get scared. So we have a formal dermatology program at the skin clinic where we would give you an appointment card. And if we suspect, we will place you on watch. This dermatology screening or clinic, we actually have that these clinics in, I think, we have 15 clinics monthly. So we will go, for example, to Linden every first Tuesday. We're in Industry Health Center, we're at Soestdijk Health Center, Grove Health Center, West Demerara, Perica, we're at Metameer-Zorg, we're in Clonbrook, and we're in Grove. And sometimes in regions where we don't even have cases of leprosy, or never have cases of leprosy, say for example region 8 and 9, every quarter the skin clinic will visit to do some checks, do some skin clinics, and most importantly sensitize the healthcare worker about signs and symptoms of leprosy.
And sensitization, as you would have mentioned, is very, very important. As you spoke earlier, you spoke about stigma and discrimination, and this is one of the things that we really want to eliminate, especially with leprosy. Could you tell us, how can this be done? How can everybody come on board and ensure that this is eliminated?
That is a whole session. We need a whole session to talk about that. But most simply, how stigma and discrimination is so important. It's like we are on the verge of trying to eliminate the transmission of leprosy. And the thing is, if we do not eliminate or stop stigma, we will not get close to our goal. So basically, stigma reduction starts with our new patient. Once we would have diagnosed them and do the specific examination and we give them their treatment, that stigma reduction should start by counseling them and making them aware that, this is like any other disease.
Yes.
It's not the disease of the Bible. It's not as hopeless as it was back then. The treatment is effective. All right. And then once the patient feels a little comfortable, this stigma reduction ensures that they are compliant. They stick with their treatment, and also they give us the permission to divulge their disease to their family members, and then hopefully to neighborhoods, and then to work. And so, because remember, what a stigma causes, it means that patient hides away. This patient moves from the skin stage to nerve damage, and it also means that the population that this patient is around, wherever this patient interacts, is at high risk of contracting leprosy and then starting to see symptoms after many years. And so we really need to work on stigma. First, we need to research the stigma situation in Guyana. I think there was one research many years ago, but we really need to find out the attitudes about stigma among the Guyanese population again, and then get the community, aware of this, and have the community where those patients are to be able to, to teach them about leprosy, and then having them know that it is, it's not something to avoid a person, and then also having them refer to us suspected cases. So in order to reach our goal of a Guyana with zero leprosy, we really have to work on the stigma. So we are hoping that we would have a lot of advocacy on the radio, on the TV, on pages like this, the Ministry of Health pages, and have more persons engage with the program and help their family members.
What can workplaces do to better support persons with leprosy? I know when a person is away from home, they're at work most of the day, and so that is like their second home away from home. So what can workplaces do? What can managers do to, support them even as they undergo treatment?
Well, to just not fire them. Just certain workplaces, if there is a case, remember, these cases, once they start treatment, most of them would tend not to divulge, so they just go to work. But if, for example, a case has divulged their disease and the employers know, the employers can just treat this person as any other person. Once the treatment, the special antibiotics, which is called multi-drug therapy, is started, that patient stops transmitting the germ via droplets, and the workers around them are safe. So if that employer can, accept them as any other person, and they have to continue their treatment, because if you fire a person that needs their job, can you imagine the suffering and the stigma that that person will experience? So we need to also develop strategies to go into specific workplaces based on the index cases knowledge. He has to say, okay, I need you to, it's okay to divulge my disease, and then we do our talks and, our IEC materials, information, educational, communication materials, and then make that employer feel comfortable with having a case of leprosy.
Definitely. What is the duration for the treatment?
So the duration is long. All right. A lot of people may not like that, but after research, it has been shown that the multi-drug therapy, which comprises of 3 antibiotics, based on the type of leprosy you would have been diagnosed with. If your leprosy is a mild type, it's 6 months. If it's a severe type, it's 12. And based on how you evolve and how you take your tablets, because if you're not compliant, it may extend additionally for like 18 months.
Wow.
Yes, very long. But that is why we're here. We're not only here to give the tablets, but we encourage patients to, you can do it. Let's do it. And when they learn that the tablets are effective and it protects their family members, they take it and complete it.
Thank you, Dr. Heather. We're going to go into a break and be right back.
No. Yup. No. Yup. No. Yup.
Dr. Heather, could you tell us some of the plans that you guys have for the future and what we can look forward to?
Well, you can look forward to lots of things from the leprosy program, even though it's it's neglected. As I mentioned before, we're on the road to elimination. We're trying our best to hopefully by 2030 or 2035 have a Guyana free of leprosy. So we will continue to, try to organize and sustain our capacity building, because every year we have to, review, refresh workers. There's a turnover of staff.
Yes.
Once there's a turnover, we need the new doctors to, learn about leprosy. We plan to continue and, start and continue with our preventative campaign. Not the whole of Guyana, but in specific areas of Guyana, which will be announced later. We plan to go in as a team and based on the index cases consent. We plan to also formally form our association of persons with leprosy. We want patients with leprosy to become engaged, not only to be there in the background, to actually have a voice on what the
Yes.
program can do to improve their lives and the lives of other patients. We plan to do a lot more, maybe TV ads, more cartoon-like for children, like more things so that people can understand, because I find that every year, it's the same question. They still don't understand what it is. How is it caused? It's still frightening. So we need to, get rid of that fear, get rid of all those myths. And we will improve our record keeping. We are improving from paper-based, recording of data to computer-based systems. So, and all of this is with the help of PAHO, who supports the program greatly. And we will continue our campaign in schools and hopefully in workplaces.
Thank you so much, Dr. Heather, for joining me on the program today. And I trust that you and your team will keep up the good work that you guys have been doing over there at the leprosy program.
Thank you very much.
Thank you for joining me on the program today. I'm Alicia Martin saying goodbye for now.